So certainly, for years, I guess you've been involved in ASDA, and you became president at exactly the time of COVID. So your presidency will be marked as the virtual presidency of ASDA. How's it been being president of ASDA virtually?
It's been great. I am just so honored and humbled to be a part of the board this year and to be leading ASDA through this time. The board of trustees and ASDA staff have really been incredible in responding to these unique challenges. Nobody expected this to happen, and sharing the value of ASDA through this virtual world, connecting with students across the country, and continuing to advocate on students' behalf, whether it's student debt or licensure reform issues, has been incredibly rewarding. And I'm very grateful for this opportunity.
Fantastic. So, of course, I'm sure you had certain goals for your presidency before COVID, which had to pivot. What are the goals of your presidency and of your board?
So for now, our goals are addressing the issues that dental students and the association are facing right now and providing as a value to members. So one specific goal that we've had, and something that has continued through ASDA for many years, but has seen much movement in the last 8 months, has been licensure reform. So dental students and ASDA members have been advocating for licensure reform for years. And when the pandemic hit in March, licensing exams were canceled throughout the country, and ASDA quickly met with many stakeholders in organized dentistry and regional testing agencies. So regional testing agencies expedited the release of the mannequin exam for dental licensure. The ADA released the DL-OSCE. So students had options to take alternative pathways to licensure that did not include a live patient. And so ASDA spearheaded its first 50-state nationwide advocacy efforts for licensure reform. And it has been fantastic. In 42 states so far, for at least the class of 2020, there has been change, and these states have accepted alternative pathways to licensure. So continuing that and making that, I know it's very exciting. So that has been fantastic, and really just shows that ASDA is so much bigger than any individual person. It's a culmination of so many years of advocacy efforts, and hopefully will continue to be, these positive reforms for years to come. So licensure reform has been a big deal this year, as well as our diversity and inclusion initiative. The board has developed a task force to enhance these efforts through our association. So we're excited for that. And like I said, providing ASDA value in the virtual world. So we had many webinars throughout COVID addressing various issues that are facing dental students. Last week, we had our first virtual leadership conference. So we had over 770 attendees log on for a weekend of programming to, again, address issues facing dental students. So it's been very exciting, and seeing the ways that the association, the board of trustees, and ASDA staff have adapted to these times has been very rewarding.
Fantastic. You mentioned diversity. And, at Henry Schein, we've been advocating for, must be over 40 years to advance diversity in dentistry. Obviously, sometime in the middle of 2030s, around 2040s, the majority of Americans will trace our roots to the developing world. And we held our first diversity conference at the Marriott Hotel 25 years ago, encouraging dentistry to figure out how to drive diversity in the profession, leading to the establishment of our Diversity Inclusion Council at Henry Schein, where we have a women's leadership network. We have a network that deals with the LGBT community and communicating what that community, the challenges that community has faced, and how that community can advance dentistry. We have a Black diversity inclusion group, as well as a Hispanic group. How do you think, what do you think ASDA could do to drive diversity in dentistry so that dentists reflect the population?
Absolutely, that's a great question. And I love hearing all of those ways that Henry Schein has advanced diversity and inclusion in the profession. I think it's incredibly important. And as you know, there are so many trailblazers that have led the way for diversity and inclusion in dentistry that, you know, my class right now, we are 50% women. We have a wide range of represented individuals. And I think that we are moving towards a more diverse profession. And I'm very grateful for the trailblazers that have led that. That being said, I think there's always room to grow, and, you know, prioritizing diversity and inclusion in our association and better understanding how we can meet the needs of our members and become a more diverse and inclusive association, but also a profession, you know, collaborating with various individuals and also being able to be better practitioners for our patients that we serve.
Excellent, because of course, people often feel comfortable meeting a dentist that understands the language, the culture, and so diversity and inclusion is really, really important in advancing oral care. So now let me ask you another question, if you don't mind. And you can feel free to ask me a question. So I'm sure you've been advocating for the digitalization of the curriculum, so you don't have to necessarily physically go into a class, and you can learn from perhaps the best in academics through lectures on the video, which would have made it perhaps difficult in the past because there's only so many classrooms that a particular professor can go into at any particular time. And so there's access to knowledge through the internet today, through the virtual video environment. Are you pleased with the outcome of digital education?
Absolutely. So when COVID closed our school in early March, our administration and our faculty worked very quickly to develop an online curriculum so that we can continue learning when we weren't in school. And so definitely enhanced our education virtually, and there is still opportunities with all these different platforms to work collaboratively, which I think is a very large part of dental education and dentistry as a profession. I also think one of the positives of this virtual world has been access to meeting people and hearing and learning from individuals that you might not otherwise have had access to hearing. Right. And I think that is fantastic. You know, you can log on to a Zoom lecture or a meeting and hear from people that you might not have otherwise been able to. And I think that is absolutely a positive from this.
So I want to ask you a controversial question.
Okay.
Do you see a time when you can sit in a class? I understand you go to Columbia, so it's a great dental school.
Thank you.
Do you see a time when you could perhaps sit in a class with a lecture from a professor at another dental school?
And well, I mean, we definitely have seen that, you know, especially having different, even when we were in person, you know, there are, especially in the New York area, dental educators would collaborate, and we have faculty that would come in, we hear from other people. I do think that there is, you know, there's value in hearing from other people, there's opinions. I am a big fan of in-person education and going to class and, you know, having that one-on-one with your instructor and being able to turn to a classmate and ask them questions. So while I have enjoyed the online education, and I do think that there are many promises for its future, I do value the in-person, face-to-face education that I've had for the last 25 years of my education.
I think we're heading towards more of a hybrid model, I think, right? Where we get the best of both.
Yes, absolutely. The best of both. That is a great way to put it.
Because we are, as humans, social animals, and we want to be close to people. And at the same time, there's expertise available around the world that we should be able to tap into. So let me ask you another question. What new topics, what new areas of dentistry would you like to see discussed in the classroom and perhaps outside the classroom with industry?
Absolutely. So I will relate to some of the things that I've seen Columbia has implemented over the last 8 months. So for us, it's about making patient care efficient, and empathetic. So understanding where everyone is coming from, especially during these times, we've all been challenged, and efficient. Our patients were without routine care for 4 months, and now they're back and engaging them in their care. So 3 things that we've seen over the last year was our integrated health electronic health record system, telehealth, and CAD/CAM and crown milling in clinic. So back in January, Columbia Dental School, as part of the larger Columbia New York Presbyterian and Weill Cornell efforts to integrate the electronic health record, switched over to Epic. So now I can be seeing a patient and have access to his or her medical records, which I think saves a lot of time and enhances communication interprofessionally, which I think is fabulous. And I absolutely think that that is a way that dentistry is continuing to go in the future. Another is telehealth. So for us, we had the opportunity to participate in telehealth when we were at home during the pandemic. We worked with our faculty and we were able to log on and meet with patients and address their concerns and then triage them to the appropriate place. We continue to do that in school now. So we will meet with patients beforehand, get an understanding of their concerns, their dental history, their medical history, and then direct them to the most appropriate care. It saves time for our patients and they have a better understanding of what they're coming into before they actually enter our clinics. So I think that is fantastic and another way that dentistry is going in the future. And our CAD/CAM. So we have Plan Mecca crown milling machines in our clinics. So you can have a patient come in where previously you would do the crown prep, take the impression, send it to the lab. 2 weeks later, the patient would come back for the crown delivery. We can do that all in a day now. It takes about an hour to design and mill the crown. Some faculty are trained in it and are very open to working with students to enhance that education. So that's been something that we've moved more towards during the pandemic. And I see that continuing both in dental education and the profession in the future.
Wow, that's exciting. Are you actually getting clinical experience on chairside milling?
Yes, so we have the mill in our dental clinic. It's right down the hall from the clinic,
Right.
And so we can work with faculty who's trained in the CAD/CAM and develop the design of the crown with them. We also are able to educate our patients on this process as well, and then deliver a crown to the patient. So we do have that in our clinic. We're lucky to have that,
Well,
and I'm
that's
excited
very,
to
very
see that use more.
exciting.
Yeah, it is absolutely.
So I have to tell you a little secret. Maybe it's not such a secret, but about in 2017, we went to the American Prosthodontics Association and suggested that we work with the association and the deans, the dental deans, ASDA, to develop a model curriculum for advancing the use of chairside prosthodontics and chairside milling. It was a little bit controversial, but in any event, the curriculum was developed and it was the goal was to have it implemented by 2019 in most dental schools. I'm glad to see it's actually taking shape. I don't know if it's exactly the same curriculum, doesn't matter. The whole idea is to advance chairside milling and chairside prosthetics for dentistry in general. So I'm glad to see you actually using a chairside.
Absolutely, yes. I'm happy to hear that and see that it's available to other dental students as well, because I think it definitely provides it really enhances our education at Columbia. So I'm happy to hear that it's a widespread initiative.
Well, I'm glad to see sometimes these plans, they take a long time, but this one actually got done. So, but I think Columbia is anyway a very advanced digital school, always been on the forefront. So let me ask you another question, and maybe you have a thought that you want that I don't cover or that you'd like to talk about. But what was your most memorable moment in dentistry during COVID?
In dentistry during COVID? For me, I think it was returning to clinic. We're still in the middle of a pandemic. If anything, it's getting worse. And having an administration and faculty and our patients that we were able to return to clinic safely and see the changes in our clinic to make it a safe environment for our students, our faculty, and our patients, and be able to provide care after being out of clinic for so long. I was just so happy to go back and be able to provide care to my patients and the community, and looking forward to it, as we've talked about, these advances in dentistry and dental education, and really being in the forefront of that as those changes are happening.
Fantastic. So, Sydney, there's been a lot that has been written to show the direct correlation between good oral care and good health care, whether it's in the pulmonary area, the cardiac, the diabetes. Even there's a few articles on obstetrics, and there's even an article on Alzheimer's showing that if you take care of your oral care, you will lead a better quality life, you'll have better health care. Is this an area that, of course, I would ask you, interests the younger dentists of today?
Absolutely. And I think for me, that was one of the reasons why I decided to go to Columbia, because there is such a strong focus on integrating oral health with your overall health. We started in our didactic curriculum working with med students and understanding your entire body and patient's health and how oral health will affect their overall health, and through our interprofessional collaboration throughout school. And I'm looking forward to continuing that during my career as well, because I think there's so much value in working with a patient, whether it's their physician, nutritionist, social worker, to provide optimal care and high quality care to your patients. And it's so important. And we see it now, especially, with everyone's health is at the forefront of their minds right now. And having access to high quality, affordable healthcare is incredibly important to maintain overall health.
Right. Very, very good. We agree with that. Our business involves a dental business and a physician business, so we believe the two should work together. Is there any message you would like to send to either students, to academia, or to the dental industry for that matter?
Absolutely. I think right now, so much is about taking care of yourself. Dr. Rupali Kulkarni, she was our previous ASDA president. I was on a webinar that she was hosting a few weeks ago, and she said that you can't take care of others unless you take care of yourself. And that resonates so true with me. I think, especially throughout the COVID pandemic, something that I and dental students and dental professionals have, and really people across the country, have had to focus on, is maintaining your mental health. And I think it's so important to take care of your health so that we can take care of our patients, and so that we can be there and show up and make their world a better place, do what we can.
Congratulations on the work you've done through your presidency of ASDA, a time when you had to move from in-person meetings to virtual meetings, and look forward to hearing of your graduation and your next steps in dentistry. So to board, congratulations on really leading dental students through this very, very challenging period of time. So thank you for your time. Thank you very much, Sydney, and good luck.
Thank you. Thank you so much for having me here today. It was great to speak with you. I really appreciate your time.